Assalamu alaikum. I am Isma Sayyed. My roll number is BP1650097. I am from 4th year morning. My group number is 9. The topic I am going to cover is volatile inhalation agents, which comes under the main heading of perioperative care. So first, talking about the volatile inhalation agents. What are volatile inhalation agents? An inhalation anesthetic is a chemical compound possessing general anesthetic properties, and they can be delivered via inhalation. They can be administered through a face mask or a laryngeal mask airway or any tracheal tube that is connected to anesthetic vaporizer or any anesthetic delivery system. Now discussing about the currently using volatile inhalation agents. So these are desflurane, isoflurane, nitrous oxide, sevoflurane, and xenon, which are commonly using nowadays. Now moving toward the next heading, which is minimum alveolar concentration, MAC. So what's minimal alveolar concentration? It is the concentration of the anesthesia in the alveoli at 1 atmospheric pressure, which is required to produce immobility in the patients who are subjected to any surgical incision. Minimum alveolar concentration is useful in comparing the potencies of various inhalation agents. In almost 95% of the patient, the movement is prevented when the level of MAC is about 1.2 to 1.3. Now talking about the mechanism of action of volatile inhalation agents. How these volatile inhalation agents work. There is no specific receptors being identified still for the mechanism of action of volatile inhalation agents, and there is no proper mechanism still known. Fundamentally, inhaled anesthetics work within the central nervous system by augmenting the signals to chloride channels, especially GABA receptors, and they prolong the inhibitory effect and reducing the excitation of neurons, and thereby depressing the neurotransmission pathways. Now, coming towards the uses of volatile inhalation agents. So, volatile inhalation agents are used in the induction of general anesthesia and maintenance of general anesthesia in the operating room. These are basically used to induce general anesthesia. Now, the adverse effects which are involved due to the excessive use of the volatile inhalation agents. So, some of the adverse effects are post-operative nausea and vomiting, risk of malignant hyperthermia, nephrotoxicity, hepatotoxicity, neurotoxicity, and cardiac arrhythmias. Now talking about the soap notes. So what are soap notes? Soap notes are actually prepared for the documentation of any case study of patient. Soap notes basically have four main components: subjective, objective, assessment, and plan. SOAP is actually the abbreviation of these four terms. So first, what is subjective? In subjective, we are talking about the chief complaint of the patient and his or her medical history. Then objective. In objective, we are talking about the patient's current situation and like the lab reports of the patient. Then assessment. In assessment, we are talking about the condition which we assessed and the disease or condition we diagnosed. And then the plan. In plan, we are talking about the treatment. We suggest the treatment on the basis of the previous diagnosis that we observed. Okay, now coming towards the case study. So here we have a case. CK, a 26-year-old man, ASA1. He is scheduled to undergo laparoscopic hernia repair on an outpatient basis. During his pre-operative evaluation on the morning of surgery, his BP is 115 to 75 mmHg, which is normal, and his heart rate was 70 beats per minute, which is also in the range. The duration of surgery which is expected is to last is less than 2 hours. So it is planned to give a propofol induction by the maintenance of the general anesthesia with desulfuran without the administration of the nitrous oxide. After the induction of the anesthesia, we'll see that the level or the concentration of the desulfuran in the vaporizer rapidly increased, and within 1 minute, CK's BP and heart rate increases, and BP increased to 148 to 110 mmHg and heart rate to 112 beats per minute. So what's the cause of this increase in the BP and heart rate, and how we can prevent it? Now we have to solve the case. So first, talking about the subjective. The gender is male. Age of patient is 26 years old. The chief complaint of patient is that the patient is suffering from hernia. Medical history of patient is patient undergoes laparoscopic hernia repair on outpatient basis. Objective. We Some lab reports which are given are BP and heart rate. The BP is 115 to 75, which is in the range, and heart rate is 70 beats per minute, which is also in the range. Duration of surgery, which is expected, is less than 2 hours, as we told it earlier. Now coming towards the assessment. So we have seen that before the surgery, when the anesthesia has not been induced, the patient's BP and heart rate was in the range. And after surgery, when the anesthesia has induced, the desulfuran concentration increases and patient's BP increases to 148 to 10 mmHg and heart rate to 112 beats per minute. It is all due to the desulfuran, because desulfuran can activate the sympathetic nervous system with the increase in the BP and heart rate in certain conditions. Also, we can see that minimal alveolar concentration is also increased to 1.1, which is above the range. So this is because we haven't administered desulfuran with nitrous oxide. So we plan to administer desulfuran with nitrous oxide. Now coming towards the plan. So in plan, we have to suggest the treatment which is best for the patient. So the best choice of drug in this condition is fentanyl, because fentanyl effectively decrease the heart rate and BP and keeps it in the normal range. Fentanyl also have effects on the cardiovascular depressant and post-operative sedative effects. Uh, Also, we have to use nitrous oxide with desulfuran. We have to administer nitrous oxide with desulfuran to the patient because by this our MEC level maintained at its concentration, which is less than 1. Also, by administering nitrous oxide with desulfuran, the heart rate and BP will keep in the normal range. So here our case study is completed. Now we'll talk about some drug interactions. The potential of volatile inhalation agents increases with some of the drugs that are opioids, benzodiazepines, alpha-2 agonists, and neuromuscular blocking agents. These drugs will increase the potential of the volatile inhalation agents, and their administration will permit to use lower doses of volatile inhalation agents, and these lower doses will then reduce the adverse effects of inhalants. The presentation has been completed. Thank you.